I specialize in head and neck cancer survivorship and prostate cancer survivorship. Um, and I've been there for about a year now.
Okay. So you described our first question, which is what field of health do you work in? How does evidence-based practice impact your field of work?
Well, we're an academic teaching center. Every single day we practice by evidence-based practice. The main goal would be that the patients get the desired outcome that we want from their treatment. So um, every week we will evaluate the most recent guidelines that have come out from ASCO, the Red Journal, the New England Journal of Medicine, um, and make sure that it's not only cost effective for the patient, they get the desired outcome, it's efficient, but we do everything based on evidence for the patients.
Okay. So when you see these evidence-based practices weekly, what is your organization's process for adopting the best practices or evidence-based practices that you guys review or look over?
So we we have a quality committee that meets every 2 weeks, and we review the latest evidence that's come out in regards to radiation dosing, medication management, treatment side effects, and survivorship, which is really becoming the forefront of oncology care, which is what I'm actually in charge of. So we have a quality committee that reviews evidence base. We do a weekly chart round with our residents, which I actually learn a lot from, but our residents will review journal articles that have recently been published from Astro, like I said earlier, or the Red Journal, New England Journal of Medicine, which are all radiation or oncology-based professional organizations that release results from clinical trials, but we are at the forefront of the latest and greatest that's come out. We also do a multidisciplinary tumor board conference related to each specific disease site every week. So it ranges from gynecology, lung, brain, head and neck, thyroid, and breast tumor conference. And what we do there is we sit with a multidisciplinary team. So there's the surgeon, oncologist, radiation oncologist, the pathologist, a radiologist, and we review cases every week, and everybody provides a group-based recommendation for the patient. And it's really taken oncology care to the next level. I mean, it's a group-based decision. Everybody provides their evidence-based recommendation, and it's great for collaboration. So I've been able to join some of those tumor board discussions as I am an extension of my collaborator, and I can also answer any questions that the patients may have. So we have the quality committee, chart rounds, tumor board, and then also we do clinical trials. So we review and also think of things that we could maybe do better and propose new clinical trials that the patients can be a part of.
Okay. So with the committees and the decisions that you guys make weekly and all the other resources that you use to adopt the best practices of evidence-based practice, can you provide a specific example of evidence-based practice that you have utilized?
So I was brought on for survivorship purposes. So we have come so far with cancer, and specifically head and neck cancers. So many of the cancer patients that I see are HPV-driven head and neck cancers. So base of tongue, tonsil, or any oral cavity type of cancer. Well, HPV, which is really coming through with a lot of cancer, most of the time you hear it with cervical cancer diagnoses, but it's actually really common in males for tonsil and base of tongue. So these patients are getting diagnosed in their 20s, 30s. They have a very curable cancer typically, and the HPV tumor marker is actually a good prognostic marker to have as far as their treatment response. So they've accumulated all these patients, these younger patients, and they've got 40, 50, 60 years ahead of them, but yet they're still dealing with the side effects of cancer. So we are accredited by Cancer on Commission, and they made it a standard that we are to provide all of our patients survivorship care plans. At some point, every patient will have a survivorship care plan. This year, they made it a recommendation to have 25% of all analytical cases receive survivorship care plans that it's appropriate for. So stage 1, 2, and 3 disease, and any disease that's curable, these patients are to receive a survivorship care plan. Because they have found over many years with these patients that are living longer and being cured of these diseases that they need someone that focuses on their long-term side effects. And they've got this data based on surveys, based on follow-up appointments, long-term side effects. So for head and neck cancer patients, specifically, they're dealing with head and neck lymphedema, scar tissue buildup in the neck, trismus, dry mouth, taste changes. Some of them are feeding tube dependent, but they're living several years. So based on many surveys, based on measurements for lymphedema, they've decided that, hey, we need someone that will carry on the follow-up and specifically for survivorship for head and neck patients. So that's what I've been brought on to do. So what I did was created a template that pulled in all cancer patients' chemo regimen, radiation regimen, or if they got one or the other, they would automatically come into this survivorship care plan. And it listed their entire treatment team, the day they were diagnosed, what kind of cancer they had, what stage it was, any tumor or prognostic markers, surgical history, family history, then their treatment summary at the end, and then expectations of what they can expect after their treatment. So once again, touching base with what they found out over the years of these survivors, what they were dealing with. So we added indications for lymphedema therapy to the head and neck area. This is, once again, specific for head and neck cancer patients. Physical therapy, occupational therapy, and really incorporating this multidisciplinary aspect for these cancer patients. In addition to support groups. So we've created support groups for these patients and really just try to carry them on through the continuum of care and living with a curable disease and then just being in survivorship. So a big push for KU has been survivorship at diagnosis. So I actually see these patients the first day that they come in and then throughout their journey with cancer treatment and then thereafter. So we have, after the patients finish, I print their survivorship care plan, which lists their treatment summary and everything that I just listed. And then basically just walking them through the steps of after diagnosis, which can actually be the most difficult time for patients. So survivorship care plans have been our quality evidence-based practice that we've initiated. And we actually just got an email this week. So our goal is 25% of all analytical patients. And we met that goal as of this week. So that included 1,253 patients, and we've already met that goal, so which is awesome. So that's a quality evidence-based practice that I'm personally working on. Other examples would be dose volumes versus toxicities from the treatment that the physicians and the residents more so deal with.
Okay, so you say that survivorship is kind of this forefront of what you're kind of doing now, and you're brought on to specifically do, survivorship and you're developing all these templates and all these resources for the specific evidence-based practice. So tell me, how do you determine if the practice works as it was intended?
So we've just kind of initiated this, so we're kind of in the forefront of figuring out follow up and just to see, is this beneficial for the patients or is this just another piece of paper? So right now we're doing 2 quality of life surveys that are based out of the University of Washington and a Yale survey that is capturing if these patients are benefiting from these survivorship care plans and this more in-depth look at their life after cancer diagnosis. So what I'm doing is a quality of life questionnaire at baseline, so when they're diagnosed and prior to treatment, 3 months after treatment, 6 months after treatment, a year after treatment. And so what I'll do is I'll gather this data over several years and then hopefully use this as a research component